Hi there, I'm Dr. Sheldon Stuckart, Clinic Director and Chiropractor at Kaiser Health in Rockville. I have a Doctor of Chiropractic. I have a Bachelor's in Exercise Science. I also am trained in dry needling and other manual techniques. In the scope of Maryland, I have the physical therapy privileges. Sciatica actually affects a lot of individuals, especially with working from home nowadays, sitting a lot. So sciatica can come from your back, your low back, or from your piriformis or glute muscles. It involves the L4 to S3 nerve roots. So a lot of times with sciatica, you can have pain in the low back and you can have pain that's shooting down to your leg. Or people can experience the symptoms worse when they're sitting longer for prolonged periods of times. That could be at work or driving or just at a computer. So sciatica involves these nerve roots down here and the ones that go through the spinal canal, and they actually exit out of this greater sciatic notch right behind your, inside your butt cheek, and then goes down the leg here. So you can have sciatica from disc herniations like this, if it's compressing on this nerve root. If the disc is just shorter, so there's less space for the hole, or if you have something called facet syndrome or facet arthrosis, where you basically have bony spurs or osteophytes that can crowd the nerve and cause compression, and then that can trigger sciatica as well. Also, piriformis syndrome, if you don't have low back pain, but you have pain starting in your butt or glute, then the muscle here, the piriformis muscle that attaches from your hip to the sacrum, can also pinch on the sciatic nerve. There's different variations of the sciatic nerve. It can go over the muscle, it can go under, it can actually split in two sometimes, depending on what it is. But a lot of times when you're sitting, you're compressing this nerve as well. So that's why it can also make the pain worse.
Is it common to have pain on both sides or sciatica on both sides?
Yeah, depending on how you sit, how long you sit. Usually it's one-sided though, but if it is equal on both sides, then we might want to look up higher. So maybe the issue is more in the low back, and then it's coming from both sides down versus one. Because normally we have a favorite side to tend to lean one way or the other while working, driving, or on the computer. So like before, I said that sciatica does have pain either associated in the low back, glute, or both, and it shoots down to the leg. Some other pains can be just sharp midline pain or one-sided back pain without the radicular or the referral pain symptoms. It could be the facet arthritis spoken before, or it could be disc pain, where if sitting makes it better and standing makes it worse, or bending down makes it worse, or extension makes it worse, or squatting. So you really have to try to figure out what movements and what things you're doing position-wise make the pain worse, to figure out what the pain or the problem is coming from. Good history is the first line of defense or our detective skills for chiropractors and physicians. Basically, we just have to figure out what the symptoms are, when does it occur, what are you doing when it occurs, and how long it's been, and asking the right questions to figure out if it's sciatica or if it's something else causing the pain. Once I figure out let's say it is sciatica, we have to figure out okay, is it one side, both sides, whatever, and then treat either, if it's low back, the pain's in the low back as well, treat the low back, adjustments, flexion distraction stretches, lumbar core stability exercises, so core bracing, and then distraction techniques so we can open up the space here and make sure it's moving. As well as if there's pain in the glute or butt, then we have to release the piriformis and glute muscles as well, and maybe some hip mobility too, so it takes pressure off the nerve, pinching the sciatic nerve. So if I'm treating sciatica and low back pain, adjustment would be my number one. And so I definitely would want to mobilize and manipulate the spine, make sure that this guy is healthy and well, because a lot of people, even if they don't have sciatica, have low back pain, so it could be early signs that sciatica can come. But then the dry needling is really good manual therapy technique. Like I said earlier, dry needling uses monofilament needles, and it uses intramuscular stimulation where it penetrates the tissue of the muscle that's really tight or locked up, and it breaks up the scar tissue, increases blood flow and circulation, and also basically tells the body to start healing that muscle that is compressing on that nerve. And then supplement that with other, soft tissue techniques, manual therapy, pin and stretch, myofascial release techniques. It would definitely be a whole slew of things that we can do passively, and then it combined with the right exercises as well. Glute strengthening exercises, hip mobility stuff, core strengthening, and then also taking time off of sitting on your butt would help. A good amount of patients that come with low back pain do have sciatica as well. If it's straight up from the muscle, like here, like, oh my gosh, we can get this fixed in like a few treatments. But if there's a lot more stuff going on in the spine, if it's more nerve root compression, if there's like osteoporosis or arthritis in there, then it definitely will take a little bit longer, and other modalities or treatments would be needed. If it's coming from the low back and there's more comorbidities, or if there's more structures involved that's causing the pinching of the nerve root, then it might take a little longer, but at least we're on the right path where we can get imaging to find dive into that if there's nothing else going on, as well as refer to other specialists to co-manage so we can get you on the right path. That's also dependent on if the patient does their home exercises and they take away their aggravating factors. So it's a little bit harder to fix completely if the patient has a desk job and they sit all day. But I can give them recommendations on more ergonomic chairs or desks so that they can get off their butts longer, so that this doesn't occur, the symptoms don't occur. If you think you have sciatica, the first thing you should do is go to your local healthcare provider. If you have a chiropractor that you trust or someone that you know, then you should go see him or her to diagnose you properly that you do have sciatica, and some that they can fix. There's also some things that you can try at home, which is like if you have a foam roller, you can roll out the piriformis muscle that's found in your glute area, that if it's coming from the nerve down there, or if you have a lacrosse ball, you can also try that out. There's also a lot of mobility exercises that you can do for your hip and your low back, some stretches, some techniques, but you have to find out where the sciatica is coming from. Is it coming from one cheek? Is it coming from both? Or is it coming from your low back? Because that's where the experienced healthcare professional will be able to diagnose and start you on that path.